Driving 80+ miles in labor, giving birth in the ER, there's real fear for some pregnant women in rural Alabama. What will they do when Grove Hill Memorial Hospital closes its labor and delivery unit in 2 days?
I don't think that mothers and families are even their priority. We're not making in the money.
When I first found out, I was like, what we gonna do next?
People in these rural areas, we've been overlooked and forgotten for so long. I believe we've become desensitized to it.
Clark County, it's known for its quiet towns and relaxed way of life. Now, that way of life is changing. Grove Hill Memorial Hospital is ending delivery services for pregnant women on Friday.
It was a bunch of mixed emotions. There was fear, there was sadness, there was some anger, and not anger directed at the hospital, just anger being put in a situation that I did not want to be put in. It's terrifying to think about being an hour and a half away from potential life-saving care should you need it.
Jessica Overstreet is a registered nurse who chose to be a stay-at-home mom to her 4 children. She gave birth to all of her kids at Monroe County Hospital. Overstreet recently learned she was pregnant with her 5th child, one who will be born under a different set of circumstances. When labor and delivery in Monroeville closed due to what they said was a doctor shortage last November, Overstreet called Grove Hill Memorial. Now, a second hospital within 25 minutes of her home is closing down its maternity services. The hospital has claimed rural emergency hospital status. It's a designation that allows it to continue treating patients just without inpatient services, meaning patients can't stay there for more than 24 hours. It's a status that saves the hospital, awarding it $3 million a year in federal funding. But it forces the end to a nearly 75-year-old labor and delivery unit.
We have rural health care. We don't have.
At 18 weeks, Overstreet is now facing a new level of stress.
With my last pregnancy, I went into spontaneous labor at home. I almost did not make it to the hospital at all. I wound up giving birth in a wheelchair as I was pushed into labor and delivery.
She also went septic after her last birth.
I remember looking at the monitor thinking that's shock. I was literally terrified I was going to die. And I spent several days in the ICU in Monroe County Hospital, and then I come home on 2 weeks worth of IV antibiotics. Home health had to come out every day. And I want to avoid all that if at all possible. And I thought that coming here would be a good way to avoid that.
Instead, she'll have a scheduled induction an hour and a half away at North Baldwin Infirmary. A choice made for her.
They live here.
Yeah. In a coffee shop in Jackson, Kaylin Stewart rocks her baby boy Waylon. And she tells me without Grove Hill, she would have delivered in her car.
My immediate thought was, I'm glad I've already had him because I wouldn't have made it in Mobile. I went into labor as I was picking my daughter up at the car rider line, and I had to get my mom to swap out to get my toddler and to pick my daughter up from school. And I got to Grove Hill a little after 2, got checked in. They checked me at about 2:20 and I had him at 2:55. So I wasn't even in labor for 2 hours with him.
Now her heart is with her pregnant friends.
I would be terrified. I would absolutely choose to get an induction just to prevent going into labor here. Because say I had a hemorrhage in Jackson or Grove Hill and there's no OB, they cannot fly you out while you're hemorrhaging. They have to take you by ambulance, and that's an hour and a half. Not to mention the wait on the ambulance, and to be honest, we don't have that many ambulances around here.
When the labor and delivery unit closes down here at Grove Hill Memorial Hospital, women in this area, they're going to have to travel at least an hour in any direction just to get to a hospital where they can deliver their baby. When you search for hospitals with labor and delivery units on the Alabama Hospital Association's website, you'll see a dramatic emptiness on a majority of the west side of the state. Nothing for miles. The closest hospitals to Grove Hill, North Baldwin County, Selma, or Mobile. Any direction is about 80 miles away.
August 16th here, we're not going to have a 24/7 operating room.
Obstetrician gynecologist Dr. Max Rogers, who runs the labor and delivery unit at Grove Hill Memorial, sees roughly 300 women and delivers around a dozen babies a month. He says it all comes down to money. Grove Hill needed about $750,000 a year to keep delivering babies.
I don't want to leave. I don't care to leave, but I certainly understand the position the hospital is in.
Rogers is in the process of coming up with a plan for his current patients, like DeKendria Jenkins, who's 36 weeks pregnant.
Dr. Rogers, he sat down and he basically told me what it was. And I was okay then.
Dr. Rogers will be joining North Baldwin Infirmary, and some of his patients, like Jenkins and Overstreet, will follow him. Others may not be as fortunate. According to the 2023 U.S. Census, Clark County is the 16th poorest in Alabama. Dr. Rogers says some of his patients don't have a vehicle and have trouble just making it to their routine appointments in Grove Hill.
We're starting to get things set up because I teach a labor and delivery class once.
Registered nurse Crystal Schauger works at the Alpha Women's Resource Center in Jackson. The center offers free services like pregnancy testing, counseling, baby clothing, and supplies and resources. Schauger says 93% of the women she sees are either at or below poverty level. She stresses the same worry as Dr. Rogers.
Moms will not go to appointments, and they may have health issues that go unchecked or unnoticed, such as gestational diabetes or hypertension. And there may be complications that, given a closer alternative, may not have happened or can intervene sooner.
According to the Centers for Disease Control and Prevention, Alabama has one of the highest maternal mortality rates in the country. Dr. Rogers and Schauger believe shutting down Grove Hill's labor and delivery unit won't make that statistic any better.
I don't know what the body count is going to have to be, but unfortunately, we can expect some really horrible outcomes, and it may take that to get people's attention, and which is the saddest thing of all. These are our citizens, they're our offspring, they are our children and our future. So I hope we come to that realization soon.
Something pretty sobering, I'm told by a nurse at Grove Hill Memorial. Last month, they had 4 women with placental abruptions. It's a serious complication of pregnancy where the mother and baby can die if immediate action like a C-section doesn't happen. Join us tomorrow night for part 2 of Undeliverable, a maternity healthcare crisis, where we learn why labor and delivery units are falling in the red and if there are any solutions to this maternity care desert. For Fox 10 News, I'm Shelby Myers.